Hello, everyone. Thank you for joining me here today. My name is Fabiana Bacchini. I'm the Executive Director of the Canadian Premature Babies Foundation. And since the beginning of the pandemic, we've been doing Facebook Lives, bringing specialists, parents from all over Canada and today all over the world to share with us what they are doing at this time or answer parents' concerns and questions during the pandemic. And today we are going to talk about fathers, because it is Father's Week in Canada. The 21st is Father's Day, and we are going to talk about fathers and their experiences in the NICU. So today we're going to talk about the Preemie Papas Project, which is a research study aimed to investigate the mental health and parenting experiences of fathers of infants, children, and adolescents aged between 0 and 18 years old who were born preterm. And to talk about that project, I have here with us Jemima Walker. She's an honors candidate in the School of Psychology at the University of Queensland, Australia, and a member of the Neurodevelopmental Follow-up and Outcomes Group at Mater Research Institute. She's passionate about understanding the experience of parents of high-risk children, particularly those with children born preterm. This has led her research to focus on the mental health and well-being of parents of children born preterm and their families. Her main goal is to help improve the quality of life and parenting experiences. She's also the project coordinator for the Preemie Papas Project. Jemima, welcome from the other side of the world. We are so honored to have you here today.
Thank you so much for having us. We're so grateful to be here today.
Thank you. And I also have Grace Fitzallen, who is a PhD candidate in the final stage of preparing her thesis at the University of Queensland, Australia, hoping to graduate by the end of the year. And she's a member of the Neurodevelopmental Follow-up and Outcomes. Grace is passionate about understanding the well-being of children born preterm and their families. She's the study coordinator of the Nurturing Champs study and has recently published a well-received paper on this idea of preterm behavior phenotype that she can talk a little bit about that as well. So Grace, also welcome. It's so nice to finally meet you through Zoom, because we've been changing emails back and forth for the last few months for your other projects. So I'm so honored to have you here as well. Thank you.
Thank you so much for having me. It's really exciting to be here.
Thank you. So Jemima, I'm going to start with you as the project coordinator of the Preemie Papas Project. So what was the motivation behind this study?
Yeah, so as we were reviewing the literature, I engaged with multiple discussions with Grace and other members of the group. It became really clear to me that there's been relatively less research undertaken in the areas of dad's experience after preterm birth. So yeah, I recognized this gap in our understanding that really needed to be resolved. So yeah, this is where the idea for the Preemie Papas Project came from, which is a study exclusively investigating the mental health, well-being and parenting experiences of fathers following preterm birth.
That is wonderful. And why do you think this is a very important study to get through and get out there in our community?
I just think it's so important to really just shed light on the unique journey that fathers face after preterm birth. We know that, mothers have a very difficult time after preterm birth, and we also know that fathers do too, and we really just want to, bring attention to some of the issues that they face.
So I believe you feel that we do have different experiences as mother and father in the NICU.
Yeah, we do. There's quite a different set of challenges that they face around, they have to look after both the mother and the infant. They also have to coordinate with a lot of the hospital staff because the mother is usually in recovery, which can be really hard for them. So yeah, that's some of the things that we've really noticed in the literature.
Absolutely. So what do we already know about this topic?
So yeah, as I said, we know that they play a really unique role following preterm birth. And it just for a range of reasons. And also they have to find a balance between seeing their infant, and going to work. And we also know that the first days following preterm birth, fathers typically experience, worry over lack of control, emotional withdrawal, concern for mothers and infants' health, and often a lot of shock when seeing their infant. And from our understanding, it seems that these are quite pervasive factors that can affect their well-being. And we know that events which are perceived as traumatic, such as having a preemie child in the NICU, can have really long-lasting impacts on their mental health and well-being. So yeah, we really thought it was crucial to investigate these experiences and whether these will actually affect fathers later on, and whether maybe these even have positive impacts on them in the future.
Wow, that is very interesting. So this is what you're trying to learn that is different from other studies that are out there for fathers?
Yeah, I guess what's different is that we're looking at it from across the child's age range, and yeah, just the lasting impacts, as well as some of the, we also want to understand what can be positive in their experience, because we know, if this could help build resilience or to stress and things like that.
Absolutely. So are the findings going to be meaningful to NICU families and healthcare professionals? Because we always talk about, okay, so we have this study, those are the findings. So what do we do with those findings? How do they gonna play a key role in changing maybe the way we do things or the way we engage parents in the NICU?
Yeah, we really hope that these findings, first of all, can increase awareness among healthcare systems and societies around the world about the real importance of this topic. And this is why events such as these are so important to helping us increase and raise awareness in these areas. We also really hope that our findings can inform maybe, targeted support for fathers following preterm birth, which, we hope can cascade and have an impact on both the child and the family, and having a more family integrated approach. We also really hope that our findings will encourage healthcare professionals to more easily recognise that fathers are experiencing quite a different set of challenges following preterm birth than that of mothers, and that's the care should really try to be tailored to some of their concerns and worries about both their infants and partners.
So do we know how father experience the NICU, the stress that is added to their lives? Because this is pretty a long study for families with kids between 0 to 18 years old. Because from what I noticed, there's a lot of focus on the first few years, but now you're looking to 18 years old. So do you feel that the implications are very long-term for fathers as well, as we know for the mothers, but do we know the fathers is very long-term in terms of maybe bonding or their own stress and mental health issues?
Yeah, I mean, this is, I guess, one of the real gaps in the research and something that we are trying to address. We really don't know, well, from what I can see in the research, about the long-lasting effects, and this is something that we would really like to know. Yeah.
So besides the criteria of 0 to 18 years old of fathers with children born preterm, is there any other criteria to enroll fathers?
Yeah, so we also are recruiting from specific countries, as did the Nurturing Champs study, which Grace can give you some insight into.
Sure. So thank you, Jemima. The countries that we invited for the Nurturing Champs study are Australia, Canada, Ireland, New Zealand, the United Kingdom, and the United States of America. And this will be the same for the Preemie Papas Project as well. And these countries were originally chosen for a number of reasons, but I guess some of the main reasons that I'll highlight are the relatively comparable healthcare systems, some of the NICU setups are relatively similar, and also some social structures within the countries as well. So this makes it a little bit easier for both of us when we're analysing our findings and when we're making sense of these findings in terms of what they mean for the real world. But in saying this, we absolutely acknowledge that there are so many cultural and social differences, even within countries. So we do expect to see some differences still. But at the same time, we also expect that there may be some unique preterm specific challenges and difficulties in parenting based on, I guess, this shared and life-changing experience that preterm families have.
So, but besides the culture aspect, what are other differences or similarities that you are predicting to encounter? Because there's a lot of those countries that you mentioned, they are moving towards a mode of care to really integrate the whole family into the care of their baby. Mind you that now during the pandemic, the situation has changed in a lot of NICUs all over the world that we know. So anything else besides the cultural aspect, because you're absolutely right. You can change from hospital to hospital, even within the same city, how, you know, the families experience the ICU.
Absolutely. I think in terms of other differences that we may see, I think at the moment there seems to be some, I guess, comparable levels of mental health difficulties in fathers compared to mothers in the early stages, which is where the research has primarily focused, as Jemima was mentioning. But at the same time, in terms of mothers, we do see some cross, I guess, country differences long term, and we are expecting to see some of these differences in fathers as well. But at this point, we're not quite sure if we are going to see primarily the typical adjustments to parenting, but at an exacerbated level in fathers, or if there will be some, I guess, preterm specific differences that we'll see across the childhood period.
So Grace, talk about childhood period. Can you talk a little bit about your study? Because I found very interesting the way you conduct the study in so many different countries, and you have thousands of people filling up your survey. There's so much interest in that study.
Absolutely. So the Nurturing Chance study, we were very grateful in that we had a lot of interest for our study, including from yourself and the Canadian Premature Babies Foundation, which we are very grateful for. But this study focused on the behavioural and emotional well-being of children who were born preterm, as well as their parents. We did open this up to both mothers and fathers, but we think that we will definitely have, I guess, a greater uptake for fathers for Jemima's study because it is a unique and specific safe space for fathers there. But in terms of the Nurturing Chance study, there's been this preterm behavioural phenotype that's been proposed, which suggests that the different emotional and behavioural difficulties in children who are born preterm are unique and to a large extent different to what we see in children who are born at term. So there's some variation in the way that these challenges really play out for these children and these families. So our study was looking at these different challenges faced by the children from 3 to 18 years. And we really want to see how these challenges evolve. So whether they become more severe over time or if they're more severe depending on how early the child was born. We're really hoping that this gives us, I guess, a wider and more comprehensive understanding of the challenges that are faced for children.
And then so very important, right? Because I think in many years ago, they always thought only children who were born extremely preterm would have a long-term impact. But now we know through so many other research projects that that's not the case. And I'm really amazed to see how we involve the whole family in that study, because it does affect us emotionally, mentally, the way our kids go through life. I mean, my son is 8 years old. He was born extremely preterm. He has cerebral palsy and many medical complications. And I totally understand the impact on the family, mother and father, because of that circumstances that, you know, for the birth of the child. But I'm so grateful to you that you're doing this study and really looking at mothers and fathers. But Grace, I think my next question is because how fathers got engaged on the Nurture study, because we Canada, we kind of struggle to really engage fathers in anything that we do. Either as a research project or groups or quality improvement projects. It's really hard to engage dads and keep them engaged. So how was your response with fathers on the Nurture study? And I guess, what are you anticipating in terms of fathers' engagement for this new study?
Absolutely, and you raised some absolutely fabulous and accurate points there in terms of level of engagement. So we did open the Nurturing Chance study to both mothers and fathers, and we really did try to, I guess, engage fathers as much as possible, because we did recognise this gap in our understanding of their experiences. But unfortunately, we have data for over 2,000 parents, and unfortunately we have less than 100 dads. So even though we did try, I think that this Preemie Papas Project really provides a specific space for fathers to share their experiences. And thankfully, we've had a really good uptake for Jemima's study so far. So my anticipation is that it's going to engage fathers quite well, particularly because it does have this unique focus on just fathers this time.
Now, Jemima, anything to add there? How you're going to recruit that? Because we do have an Instagram account, we have a Facebook account that please share with us how they can join the pages to follow and to participate on the research. We're also going to make the link available on our social media channels, but how they can get engaged and learn more about the study.
Yeah, so simply by following us on Facebook and Instagram is a really great way to learn how to be involved. We have had such a great response so far. You know, over 50 fathers have, you know, done the survey just in like under a week, which is incredible. We're also, you know, reaching out to some preemie dad specific platforms, which have been so lovely in sharing our project, which I think has really created this community for the preemie dads. So that's been a really great way to reach out to them and along with some of our other great partners. So yeah.
That is great. And I have a question for you, just out of curiosity, because I have a feeling that fathers who are experiencing an ICU right now are having a very different experience than fathers who experienced an ICU just 5-6 months ago before the pandemic. Because I don't know how it's happening in Australia, but in Canada, in most of the hospitals at this time, one parent in a period of 24 hours is allowed in the ICU. So parent presence has been very limited. And from what we've been gathering, mostly moms are in the ICU because dads are either at work or dads are not breastfeeding. So moms are breastfeeding, so moms are staying most of the time in the ICU, which long-term could that possibly affect bonding? So we don't know what's gonna come out of this. But are you putting any addition into the survey for parents who are actually experiencing an ICU now? Because they might have a very, very different experience altogether because of the pandemic.
Yeah, you raise a really good point here, and I think this is something that we're definitely being mindful of when we are, you know, going to be analysing our results, because, you know, these are such unusual circumstances, and I think it would definitely, as you said, have such a huge impact on how fathers can experience, you know, the NICU journey. So yes, we definitely are being mindful of this. And we'll probably be looking at the comparisons between those who are experiencing the NICU journey now and those who have experienced it in the past.
Yeah. So what is your goal? How many dads is your ideal number to have this like very good data for fathers all over these countries that you've mentioned?
Yeah, well, we're really hoping for as many as we can get, but we're aiming for about 900.
Okay, let's help. We're going to help you to get there. We're going to try to engage as many Canadian dads as we can. So I think my last question is, what would you like to see on the short or long term for dads? And are the studies going to come up with some recommendations of how to address fathers' mental health while they're still in the unit when the trauma is I guess, in the beginning of the trauma period for them?
Yeah, so in the short term, we would really like to see research, you know, continue to investigate dads' experiences following preterm birth, and hopefully this will spark, you know, a broader shift in the culture, you know, around men expressing their emotions and, you know, really being able to share their NICU journey, because we know that that's so important. The preterm birth experience, you know, as we've said, it's not just difficult for mums. We know that it is difficult for dads as well. And we want to hear their perspectives as they play such a key role in the care team. And we really hope that our study can be one of the initial platforms that sparks further research to investigate preemie dads. And in the long term, we hope that we see more targeted support for fathers following preterm birth, and we sincerely hope that this study will really increase awareness of the impact that preterm birth can have on them.
And in terms of, sorry, Fabiana,
in terms of,
I think one of the primary goals for both of our studies, just to jump in on what Jemima was saying, is definitely to help raise awareness. And that's not just, I guess, in the research field, but also for parents, different healthcare professionals, so across all disciplines, and also people in the community about the impacts that preterm birth can have on families. And recently we saw a paper published by Mandy Daly, who I guess summarized this quite well. And it states that preterm birth is not an isolated event, and it is a journey that lasts a lifetime, and which can have a profound and lasting effect on not just the child, but also the family. And this is keystone to both of our pieces of work, in that we're really trying to extend the current understanding that we have and spotlight the long-term experiences for the children, for mothers, for fathers, and even other members of the extended family unit as well. Because we know that the entire family unit can play a big role on child development and also well-being.
Absolutely, it is, and I really appreciate Mandy's work on that as well. She's from Ireland, the Irish network, and it is true, because it's not it is a long term for the entire family. Whether the child has a long term complication or not is an experience that we carry for life. Absolutely, and I think it's so very important to look at the mental health, because for so many years we just didn't talk about mental health, right? The fact that we bring that up now is so very important, and make sure we do raise awareness with healthcare professionals to include fathers in research, because usually they talk about mothers, but it's the parents, like the parents of the child, that it's the key for the well-being of the family.
Absolutely.
But thank you, both of you. Thank you, Grace. Thank you, Jemima, for joining us here today. I'm hoping your research and your survey is going to be really widespread all over the world, and you can reach thousands of dads. That is so very important. And I hope we can bring you back once the survey is over, so you can share with us all the results.
Thank you. And I would like to, if I may, also thank, I guess from the bottom of my heart, all of the parents who have participated in our Nurturing Chance study previously. We've had such an amazing turnout for these parents, and also so far for the dads as well, for the Preemie Papas Project. But our parents are the ones who are driving our research and helping us to make a difference for this amazing community of premature families. So we are really appreciative. And also to all of the incredible organisational partners, including the Canadian Premature Babies Foundation. You have all been absolutely instrumental in the success of our research. So thank you to everyone.
Thank you. Thank you, Grace. Thank you, Jemima.
Thank you so much for having us.
And thank you everyone for watching us here today. We'll be back every Monday and Friday at 1 p.m. Eastern Time, bringing experts and healthcare professionals and parents from all over Canada, and now I can say all over the world, to share their expertise, their experiences, and their knowledge at this difficult time that we are all living in right now. And every Wednesday at 1 p.m. Eastern Time, Kate Robson, who is a psychotherapist and also a mother of 2 preemie girls, is hosting real-time peer support groups here on Facebook. And to join her group, you can join the Canadian Preemie Parent Network, which is our private Facebook group for NICU parents only. Thank you and be well.
Thank you.